Okay, we're back. We've already talked about FBA and the need to understand the antecedents, operationally define the behavior, and identify the consequences that are maintaining that behavior. But is FBA enough for students with ASD? Not really. We must look at the total context of autism. We can do this by looking and using the universal iceberg analogy. How do we assess the underlying factors of behavior? Both formal and informal assessments can be used. But if you know enough about the differences associated with ASD, you don't need too in-depth of assessment. Using the TEACH approach covers many student needs. However, to address specific behaviors effectively in both self-contained and inclusive environments, you will need to analyze patterns of behavior, FBA, along with those underlying characteristics. You will need to combine the results from the collaborative assessments of underlying characteristics through the UCC and the ABCI. So in the TEACH program, you've read up about it, it emphasizes the importance of underlying strengths and needs related to the disorder. And they use the iceberg analogy to show that the observable top of the iceberg is important, but we mustn't forget those underlying massive ice or deficits of characteristics of students with autism. Here's a universal iceberg that is seen in your textbook. You can tell they've identified the loner on the playground as the specific behavior. That's the tip of the iceberg that we can see. It's operationally defined. And we understand there are underlying characteristics of autism that contribute to this. We can also look at the meltdown we discussed earlier and see it can be operationally defined, and we can identify underlying characteristics that could lead to that as well. However, the ABC iceberg that Aspie and Grossman are presenting, it incorporates an FBA by looking at the events that occur before and after the behavior with the operationally defined behavior, and also considering those underlying characteristics. Difficulties with problem solving, nonverbal communication, and other factors that the intervention must address. So here's an example from your text. That is the ABCI, I standing for iceberg. So with an FBA, we can identify and operationally define the behavior, consider the antecedents and the consequences, because we need to make these antecedents that change this environment so that they are not a trigger, and we want to change how we reinforce the appropriate behaviors and not reinforce the inappropriate behaviors. But we have to consider these underlying characteristics of autism that may lead to the behavior. Again, we have an ABCI model for melting down, combining all of the information together for a more comprehensive planning. So there are advantages of the ABCI over just FBA. Why? Because we have to understand and know there is a relationship between the characteristics of autism and the observable overt behaviors and events. Remember, those triggers are due to the underlying characteristics of autism, though. So we want to address triggers in a way that's appropriate to students with autism. And additionally, with consequences, we need to be aware that students with autism are not reinforced or rewarded by typical consequences that neurotypical peers may find rewarding and desirable. And if the behavior persists, then the usual consequences are just not effective for the student, even if it makes the teacher feel better. We can't just punish behavior. We need to prevent the behavior by modifying the environment and antecedents. We need to teach missing skills and new behaviors, and then we modify the consequences. There are 3 versions of the underlying characteristics checklist. There's the HF, which is for high functioning, the CA, classic autism, and EI, which is early intervention. Now, after you do the assessments, programs address the Ziggurat model levels, which will be discussed later. Those are sensory biological. That's the initial area to address before we can do anything. Then reinforcement. We need to think about what the consequences are and adjust them so that we are reinforcing behaviors we want to see and we're making behaviors we don't want to see ineffective. Consider sensory, visual, tactile supports, task demands, and then skills to teach. Not only does the UCC lead to collaboration, developing a full picture of the child, and comprehensive intervention, but it is a teaching tool for those on the teacher's end. It helps them understand characteristics of autism, relieving frustration through knowledge. To complete the UCC, simply put checks next to the items that describe the student. Use the notes section to bring clarity by giving specific details or communication with others. The ISSI is to be used to identify student strengths with characteristics that parallel the UCC. We always need to consider how the student's strengths can be used in the intervention design. Let's take a look at Jonathan's assessment on page 56. Next, you will be asked to answer some questions regarding Jonathan's assessment. You will need to consider how Ms. Grodesky operationalized not caring about school. What are the triggers to Jonathan's behavior? What consequences seem to maintain the behavior? In what ways are consequences thought to be reinforcing or punishing different for Jonathan? And lastly, what symptomatic behaviors of ASD do the UCC indicate and that they should be targets for intervention? Those questions will be coming up next. But to finish, I want to talk about the follow-up. Once the FBA and UCC are complete, you are equipped with information to complete the ABCI. Remember to prioritize specific items from the UCC that are related to the behaviors of concern identified in the ABC section. We can't address everything all at once, so we want to focus on priorities and the specific behavior at hand. How do you monitor growth and follow-up? Well, if you want to reduce how often the behavior occurs, then you'll just simply count the number of times the behavior occurs, if it's countable. Some things are difficult to count because they don't have a clear beginning and end. If you're trying to determine how long the behavior goes on, use a timer to determine the duration. This information is good because it will also yield how along with the length of time each occurrence was. Or you can observe the behavior to see if you note any differences. Document data, and you want to plan accordingly. This is from your textbook, an outline of, depending on the outcomes from your data collection, how you should respond. In some cases, you revise your intervention. In some cases, you revise the goal. A new Ziggurat worksheet should be completed to help you design a new comprehensive intervention plan. Thank you for your attention.